Anticoagulants versus antiplatelets. Heparin. It actually increases the action of a protein called antithrombin on factor 10A. And remember, factor 10 is where the two pathways of the coagulation cascade meet. And the A here just stands for activated. By increasing the action of antithrombin on factor 10A, prevent the conversion of prothrombin to thrombin and the conversion of fibrinogen to fibrin. Lovenox or Enoxaparin is a low molecular weight heparin. Heparin can be given sub-Q or IV. Lovenox is only given sub-Q. Here we have warfarin. It inhibits vitamin K reductase. It is a protein that enhances the effects of vitamin K, which is needed for the activation of a bunch of clotting factors. We're inhibiting the activation of several clotting factors, thus prolonging clotting time. Factor 10A inhibitors and direct thrombin inhibitors. These are our two most commonly used direct thrombin inhibitors. They directly inhibit thrombin. So argatroban, dabigatran, used in patients who have developed HITs, meaning that they cannot tolerate heparin, used in patients that require PCI or cardiac stents. Factor 10A inhibitors, apixaban, the brand name is Eliquis, and it's easy to remember that this is a factor 10A inhibitor because there is an XA right in the middle of the name of the drug. Two more things I want to mention about anticoagulants. Anticoagulants work on some step of the coagulation cascade. They will need to be monitored by either PT-INR or PT. These are blood tests that give us an estimated time for our body to form a clot. And second thing about anticoagulants, think about conditions such as venous stasis and hypercoagulability. Patients with atrial fibrillation, patients who are immobile, are at risk for a DVT. These patients will benefit from anticoagulation therapy. Some of the more common antiplatelet medications: aspirin, clopidogrel, prasrugrel, and ticagrelor. Aspirin is an NSAID. It works against COX-1 and COX-2. COX-1 and COX-2 are enzymes that are known to be involved in prostaglandin synthesis. Specifically, COX-1 produces prostaglandins involved in the protection of GI mucosa and as well as the regulation of platelets. By working against COX-1, aspirin causes dysregulation of the protection of the stomach mucosa and also dysregulation of platelets, preventing platelet aggregation. These three medications work to prevent ADP-dependent platelet aggregation. So essentially, these three medications are just straight up antiplatelet medications. Unlike anticoagulants, there are no clotting times to monitor with antiplatelet agents, and antiplatelet agents are used to prevent arterial clots. So when we give antiplatelet agents, we're thinking MI and stroke prophylaxis. Patients who have had cardiac stents placed or cardiac bypass surgery, we're going to give antiplatelet agents to prevent restenosis. Make sure to follow for more because next we're going to be talking about clotting times like PT-INR and PTT. Go Balls.